in March. They started the.
Yep. And then I'll record it. And should we get?
Speak a little faster than I thought. Pick up with the slides.
All right, Karen, now can you hear me?
Yes.
Yes, we
All
can.
right. Okay, so good morning, everyone. I just want to let you know before we start this morning that this session is being recorded, and each recording will be available up to 3 months after the conference, and we will have it posted online. And I usually do an introduction of our speakers, but this morning I'm going to allow Karen and Ida to do their own introductions. So before we get started, Karen, do you have any questions, and can you hear okay on your end?
Hear you clearly.
Perfect. I will go ahead and turn it over to you.
Thank you. Good morning. I'm Karen Matthews.
And I'm Ida Borrell. And we bring you greetings from the Chitimacha tribe of Louisiana.
The state of Louisiana is known for our delicious food. There are so many dishes to choose from, but our most favorite is gumbo, chicken and sausage, shrimp and crab, and my all-time favorite, okra and shrimp. Good.
We're also known in Louisiana for our famous Shrimp and Petroleum Festival held during the Labor Day weekend in our parish of St. Mary. People come by the thousands to Louisiana to enjoy Mardi Gras. On the reservation for the past 2 years, due to the COVID-19 pandemic, we have celebrated Mardi Gras, but not by riding floats, the traditional floats, but by decorating golf courts and still throwing beads and treats to those standing along the parade route.
I have the pleasure of serving as the Human Services Director and former Director of Health and Human Services as of June 15th, 2022. I've been employed with the Chitimacha tribe of Louisiana for 21 years, 4 months, and 3 hours. And believe me, I have enjoyed every minute. During my tenure of 21 years and 4 months, I have had the pleasure of overseeing the Human Services Department, and for the past 9 years and 9 months, I was responsible for the supervision of both Human Services Department and the Chitimacha Health Clinic. I continue to oversee the health clinic's budgets and grant awards until such time the tribe hires a health director.
Employed with the tribe for 10 years. My experience with the Chitimacha tribe includes serving as a deputy clerk, a probation officer with Chitimacha tribal courts, before being promoted to Social Service Specialist 1 and then to Social Service Specialist 2 with the Human Services Department. I'm a proud veteran of the United States Army and a former law enforcement officer. As most of you are aware, social services is extremely popular, so I serve as in-house security.
You can laugh, I was only joking. The goal 9 years and 9 months ago was to combine the health clinic and human services department to create a holistic treatment approach beneficial for our patients and clients, as both departments had worked closely together in meeting the primary care, substance use, and behavioral health needs of our tribal members for many, many years. Our team was so successful that the Tribal Council acknowledged the tremendous growth of both health and human services and wanted to continue the growth for both programs by separating the programs with our own space allocation, as well as each program having their own director. Human Services' new location on the reservation will be adjacent to the health clinic, so we did not move very far.
In Human Services, our mission is to improve the lives of tribal members, one day at a time, by working collaboratively with other tribal departments and agencies in addressing the needs of tribal members. We collaborate with federal, state, regional, and parish partners in the united effort to prevent child abuse, neglect, substance abuse, domestic violence, criminal activities, and promoting safe and stable tribal families on the reservation in our service area of St. Mary Parish. Human Services is the first stop for anyone needing help, the first call for any question that can't be answered. No one is ever turned away without someone helping the client with the resource. Like my supervisor would say, when the question is asked, what does human services do? Ms. Karen reply is, whatever ails a tribal member.
Now, you probably know that we are really truly from the South. And we realize that, perhaps the word ails may not be a word that you're familiar with. But if not, ails is defined simply as troubled or afflicted, someone in mind or body. Bothered, burdened, distressed, cause trouble to, cause suffering to, beset, harass, worry, oppress, annoy, vex, irritate, exasperate, strain, stress, tax, torment, plagued. And we know if you are in healthcare and our social services, we deal with patients and clients who are facing many issues on a daily basis. And some contact us at least once or twice a week because those we so graciously serve are in need of services, and we are sometimes the only lifeline they have left, as they have burned many bridges with family, friends, and the community. The COVID-19 pandemic only heightened the needs of tribal members and their families. What was different for all of us this time was that the pandemic did not only affect our patients and clients, but employees and their families likewise.
Ms. Karen and I have been asked by USET to present on the topic Sustainable Improvement Practices Developed During the COVID-19 Pandemic. To help our audience understand the subject matter, we thought it would be befitting to share the tribe's infrastructure, which includes some photographs of the various departments. We do need the audience to be aware that the Health Clinic and Human Services is not an island to themselves. One important key factor is that when Ms. Karen arrived at the Chitimacha Reservation 21 years ago, 21 years, 9 months ago,
21 years and 3 hours.
She made an effort to work with various departments in order to ensure the best outcome for clients seeking services through human services. She has been a firm believer in wraparound services. So we worked together during the pandemic, during the public health emergency of the COVID-19 pandemic. The quote, teamwork makes the dream work. And that continued effort is the source of the success of the Chitimacha tribe of Louisiana, effectively managing COVID-19 with 0 reported deaths, only 2 adult tribal members hospitalized, 1 male, 1 female, with both returning home without significant complications.
We believe that it is important to share with our audience the tribe's infrastructure, whereby you can understand our successes was a team effort with other departments, not just, as Ida said, health and human services. As stated earlier, teamwork makes the dream work, and so befitting with USET's conference theme this year, healing through connection.
Ashna, which means hello in Chitimacha, you are now entering the sovereign nation of the Chitimacha tribe. Next. The tribal school. This photo is a mural in the lobby of Chitimacha Tribal School. The mural was designed and painted by a tribal member. The tribal school provides educational services for students in pre-K through 8th grade. Additionally, there's an aftercare program providing homework assistance, a safe place for children until their parents are off from work, as well as some fun activities. The after-school program ends about 5:30 p.m. And it should be noted that our pre-K and kindergarten students are transported by school bus to the daycare located on the reservation. During quarantine and isolation due to a positive COVID-19 case, the classes were contained to that particular classroom. If there was a teacher that tested positive or a student that tested positive, to prevent the spread of COVID-19, the school made sure that those kids stayed in that particular classroom. The tribal school took appropriate measures by keeping classrooms separated and providing students with their breakfast and lunch in the classrooms. Tribal School increased their janitorial staff from 2 to 3 janitors to assure the proper cleaning and sanitation measures to make sure that we reduce the spread of COVID-19. Upon arrival at Tribal School, students as well as teachers were submitted to daily temperature checks.
The next photo that you are going to be viewing is that of the front entrance of the health clinic. This shows the addition to the front of the building entrance, which now affords the primary care as well as our pharmacy staff to provide services curbside in the event of inclement weather, giving some coverage of our staff and patients. We also have another photo that will show you a sign that's posted advising medical testing in rear of building. One more. There we look at the sign. The next photo you'll see is the back of the building, the rear, the awning on the rear of the building. Also protects staff and patients as tests can be administered while patients remain in their vehicles. And we also have 3 testing areas under the awning. The canopy is what they refer to as the front entrance, and the awning was added to the health clinic through constructions through a grant with funding from the CDC, the Centers for Disease Control and Prevention. The remainder of our CDC funding was utilized to contract with a professional cleaning company for deep cleaning and janitorial services for the health clinic. I mentioned the tremendous growth of the health clinic and human services department within the past 9 years and 9 months. We increased our dental clinic from 1 day a week to 3 days per week. Our dental hygiene clinic has increased from 1 day a week to 2 days per week. Our community health representatives have increased from 1 in 2015 to 3 as of 2021. Our pharmacy department initially hired contract pharmacists who worked part-time hours, less than 40 hours per week with no assistance. We were fortunate in the year 2014, we hired a full-time pharmacy technician, and she helped our pharmacists prepare the medication, as well as she also helped in filing with third-party claims for reimbursement from insurance companies, Medicaid and Medicare. Now, in 2016, we hired a full-time pharmacist, and in 2019, we hired a substitute pharmacist to provide coverage in the absence of our full-time pharmacists when needed. We also hired a substitute physician to provide coverage of our primary care department in the absence of our clinic physician due to vacation or illness. As of August 27th, 2021, our physician of 9 years retired after 27 years of primary care family practice. Prior to his retirement, our only clinic nurse resigned in the midst of the COVID-19 pandemic. We were able to hire 2 LPNs as clinic nurses, one with 13 years of nursing experience and the other with less than 3 years of nursing experience. However, she was pursuing becoming a registered nurse and was already a certified pharmacy technician. In Indian country, it is so important to remember that we do more with less. And in doing so, you have to hire staff with multiple skill sets to provide coverage in the absence of another employee. We were proactive and secured 2 family practice nurse practitioners as substitutes prior to our physician's retirement to have a smooth transition and still be able to provide medical services as needed in the absence of a physician, and to be somewhat proficient in using RPMS, Response Patient Management System, electronic health records. We were doing all of this in the middle of the COVID-19 pandemic. Now, one of our 2 substitute nurse practitioners accepted full-time employment with the health clinic on October 1st, 2021. Additionally, we also utilized a psychiatric family practice nurse practitioner to address the psychiatric and behavioral health needs, as well as medication management of our patients via telebehavioral health. We were fortunate to receive a grant award from HRSA, Health Resource and Service Administration, which afforded us the opportunity to contract with a physician and a lab technician. I will speak more regarding these two positions later in the presentation. Through our provider relief funding, we were able to contract with a company for nursing staff to assist our 2 new clinic nurses with our COVID relief efforts, as well as the primary care needs of our patients. Now, I do have to share with you that our clinic nurse with 13 years of nursing experience resigned due to not only her husband, but her father-in-law both having had heart attacks. To God be the glory, I was able to bring our clinic nurse back as a substitute, and of course, we rehired her. Human Services was tasked with determining eligibility of tribal members for programs which allow for payment of utilities, housing assistance, food, etc., due to a diagnosis of COVID-19, being isolated, quarantined, unemployed, or underemployed, etc., during this pandemic. Our social services specialist 4, who is also a licensed professional counselor, she resigned, but agreed to continue providing counseling on a limited basis as a part-time employee. Her expected official day of resigning will be October 1st, 2022. We were able to rehire and have an experienced social service specialist 3 with a master's degree in human services. We were fortunate to also contract with a Chitimacha tribal member enrolled in a PhD program and only has her dissertation left to complete. She was already providing counseling services at no charge to the tribe as a part of the tribe's scholarship program requirements.
Chitimacha Tribal Courts and the Learning Center. Both programs are housed in one building, but not accessible in the interior to each other. The tribal court contract staff included a chief tribal court judge, 3 appellate judges, a prosecutor, who also is defined as our tribal representative in cases such as child in need of care matters. We have a defense attorney, lay advocates, guardian ad litems, which are advocates for a child whose welfare is a matter of concern for the courts. An attorney, lay advocate, or someone close to the child can be appointed as their guardian ad litem. Chitimacha Tribal Court handles a variety of cases such as criminal, civil, disbursement of trust funds, and the tribal court also employs a clerk of court, a chief deputy clerk, and assistant deputy clerk. The Learning Center is a new program to the tribe. It was actually created during the COVID-19 pandemic. This Learning Center is available for students interested in virtual learning as well as a homeschooling online setting. The photos you're seeing is the photo of the interior of the Chitimacha Tribal Court. And due to COVID-19, court hearings were held virtually to slow down the spread of COVID-19. Although we have returned to the courtroom, some clients that are incarcerated or in treatment facilities still appear virtually. Our Chitimacha Police Department we have a chief of police, 10 full-time police officers, 2 K-9 officers, 1 K-9 detects illegal drugs, the other detects explosives. Next picture. In our fire department, not only does the fire department provide fire protection and medical assistance by first responders on the reservation, but it also provides services to the community of Sheraton as well as the St. Mary Parish area. Our fire chief also heads our emergency preparedness, and his department has been very supportive working with us during the pandemic. by assisting with the mass distribution of items to tribal members in the community. The fire department has kept us up to date, has kept up with the inventory of COVID supplies at no cost to the tribe. Our fire department consists of 7 full-time employees and 4 substitute employees.
This is our recreation department. It's a full fitness center with exercise equipment. We have a swimming pool and kayaks and organized sporting activities for children, youth, and adults. They co-sponsor a lot of our diabetes grant activities and host summer day camp for children and youth. And they work closely with us in trying to make sure that they're taking all of the necessary precautions in terms of to slow the spread or stop the spread of COVID-19 on the Chittimuncha Reservation. The next photo that you will see is our mausoleum, and the mausoleum is for tribal members and their non-tribal spouses are buried here on the reservation.
Next slide is our River King community apartments for our elders. Elders aged 55 and older can apply to rent one of the 16 apartments designed with 1 or 2 bedrooms. Some residents live on their own. Others have assistance provided by family members, home health agencies, or other programs for caregivers operated through River King. Elder lunches are provided by River King for the elders residing at River King Monday through Friday. There's group activities for our elders, but that was limited due to COVID-19. The senior director of River King confers with the health clinic in her plans to resume these activities, but to also protect our elders. The elder program co-sponsors many of our health clinic activities regarding diabetes. This is Yamahana, our tribally owned daycare. The daycare center provides daycare for infants from 6 weeks old to 4 years old. The daycare provides an after-care program, a summer day camp program, and their COVID-19 policies is similar to the tribal school in only closing when the classroom affected by COVID, only closing when one particular classroom is affected by COVID-19. The daycare is now administering COVID tests at the center to reduce the spread of COVID-19 as quickly as possible.
That concludes our slideshow of some of the departments. However, we're going to share with you some more information pertaining to some of our other departments. Housing department addresses the housing needs of tribal citizens. They sell and they buy houses and have a housing board to determine who is eligible and should be awarded a house on the reservation. The housing board conducts housing inspections once a year, and the tribe is currently working on a project to erect 15 new homes on the Chittimuncha Reservation. Our housing department works closely with our human services department when they identify homes on the reservation that can pose a health hazard for residents and work out solutions to correct these issues. We also have a development department, and they focus on our roads being repaired, building plans for constructions of new buildings, as well as reconstruction of existing buildings.
We have a public works department that basically take care of the routine maintenance of the offices, the grounds, and vehicles owned by the tribe.
And we also have an administrative building which houses our chairman, our vice chairman, who is also our chief administrative officer, and she's also our tribal administrator. And I will say for the Chittimuncha tribe, although they are females, the Constitution has not been changed for it to be chairwoman. So we have to refer to them as chairman. Our budgets and contract department have worked with the health department to spend our grant funding timely and appropriately. And of course, I told them my best friends are the finance departments because they make sure they write our checks. But finance department makes sure the financial reporting of grants is submitted within the allowable time frame and is accurate. Our culture department, they do several things, but I do want to highlight for this audience today that the tribe a few years ago was really blessed in receiving a Rosetta Stone grant, where Rosetta Stone recorded the Chitimacha language. And the children who are at the tribal school participate in culture classes where they're learning it via computer at school, and adults can also learn in the privacy of their own homes. The culture department also maintains the tribe's museum and history. Culture department director also oversees the enrollment department. We have a human resource department, and of course, human resources is all employment matters and keepers of employee referrals for COVID-19 testing and return to work. This has helped to reduce the workload of the health clinic staff tremendously.
And our IT department assisted with providing all things computer. Lots of laptops, printers, and shredders were purchased during the pandemic to assist employees that was fortunate enough to work from home. I was not one of those.
Neither was I.
Two of several enterprises that the tribe owns, Raintree Market, that's the local grocery store that assisted human services and the health clinic by providing meals for our stay-at-home lunches or stay-at-home health fair. We did drive-by health fair twice during the pandemic. They provide lunches for our annual fitness challenge. The Cypress Bayou Casino and Hotel was also another enterprise that assisted during the pandemic by hosting 2 of 3 COVID vaccine clinics that the Health and Human Services. Our action plan. During the assessment phase, Tribal Council requested each department of the Chitimacha tribe to submit a plan of action to stop the spread of COVID-19 as we continue to provide services. Chitimacha Tribal Council requested directors identify key essential staff needed to continue operating the operations of departments in meeting the needs of tribal members.
As Health and Human Services Director, I convened a meeting with my internal leadership team, physician, pharmacist, clinic office supervisor, and brainstormed ideas of how we could provide services and still keep our patients and staff safe from this deadly virus, COVID-19. Our leadership team discussed and decided on our essential staff needed to keep the health clinic operational and maintain safety protocol.
An action plan was developed and presented to Tribal Council regarding the actions the Health Clinic and Human Services would implement to continue providing medical services on site and human services staff being available on an as-needed basis. Our action plan was agreed upon by Tribal Council, including those employees deemed essential to remain working. In March 2020, the health clinic employed 13 staff members and the human services employed 2 staff members. Here we go into the implementation phase.
Tribal Council adopted stay-at-home ordinance in conjunction with the ordinance issued by Governor John Bel Edwards in the state of Louisiana. Our essential staff consisted of Health and Human Services Director, physician, clinic nurse, clinic office supervisor, and pharmacist. We realized quickly with the pharmacy department providing curbside services, our pharmacists needed assistance of the pharmacy technician who returned to the pharmacy department. Additionally, we also needed a second person to assist in the business office, so our contract health clerk returned as an essential staff member.
The health clinic remained open throughout the pandemic with providing COVID testing outdoors. Some medical assessments were conducted via telehealth and/or depending on symptoms outdoors in the back of the health clinic. The dental clinic was closed for 3 months. from March 2020 through the end of May 2020, with the reopening occurring in June 2020.
The health clinic medical transportation on and off of the Chittamauga Reservation provided by community health representatives was ceased. Staff on stay-at-home ordinance remained off from March 16, 2020 through May 18, 2020. And I would also like to add that even the tribe's enterprises, such as the Cypress Bayou Casino and Hotel, they closed all of that in order to stop the spread of COVID-19. Essential staff working submitted to daily temperature checks and random COVID-19 testing. And upon return, all staff adhered to this protocol of daily temperature checks and random COVID-19 testing.
COVID-19 vaccines were not mandated by Chittamauga Tribal Council for the health clinic and human services employees. However, majority of staff members are vaccinated, having had at least one immunization with the first and second vaccination, as well as the third and fourth booster. Health clinic and human services staff adhered to random COVID-19 testing processed through a commercial lab. The health clinic received an Abbott analyzer for COVID-19 testing and also had access to the commercial lab. Additionally, the health clinic received the ultra-low temperature freezer. The tribe also shared unused vaccines with the state of Louisiana Public Health Region 3 to avoid expiration dates.
Throughout the COVID-19 pandemic, we have utilized the Moderna vaccine. The health clinic hosted, in conjunction with the state of Louisiana Public Health and Governor's Office and Region 3 Public Health, 3 COVID-19 vaccination clinics for tribal members as well as the general public. And these events, 2 of them were held at the Cypress Bayou Casino and Hotel. And one of the events was held on the reservation at our health and wellness fair that we held outdoors. During the 3 vaccination clinic, tribal members and the general public were able to select which of the 3 vaccines that they wanted. Communication at all levels through meetings, conference calls, newsletters, emails, text, flyers, focusing on the 3 I's: information, instruction, and inspiration, we found to be quite successful. I, as the Health and Human Services Director, had conference calls with tribal council members every other week to keep them informed of our status, to keep them informed of our COVID positive numbers and how many tribal members or employees were taking the vaccine. I also had the privilege of doing a newsletter, which I think I stopped the newsletters probably at the end of May. And I think we were up to about 40 newsletters that I did to go out, and tribal members contacted me as well as non-tribal members because it informed them. I'm a firm believer that if you want to stop the rumor mill with false information, share with people what is going on, because if you can help them to understand what is taking place, how many people had COVID, that would help to remind them of trying to practice the safeguards and the guidance that had been put out by the CDC. But information, when you can inform people, it truly helps them, and it also helped to reduce the fear and panic that can happen. I remember that the tribe closes at 11:30 on a Friday, and when COVID first started, there was one employee who tested positive. And between the telephone, text message, emails, we ended up testing 35 people because panics and fear set in. And we were at work. I had to bring all the staff back to work to help. And we were at work until like 9:30. And after that, I think people learned that, okay, let's not panic. Let's follow the guidance and determine who needs to be tested and who needs to just be quarantined. But panic can set in, and it can just start with social media. It can start communicating with tribal council and other tribal departments, local, parish, county, state, regional. And I do understand that there are some states that if you speak with them, they will say that their counterparts in terms of their state, that they don't really communicate well. And like I said, I'm a person who feels like, you know what, if it's being done for the state and it's free, then it should be done for the tribe and be free. I'm known to want to try to get all the free things I can get, and it works. And we go to the table with our state partners and our parish partners and our regional partners, and they reach out to the Chitimacha tribe. And, and usually we're the first that they call. If they have a project, they call us and say, would y'all be interested? Okay, it's free. Yes, we are. And so I would say to you that, again, you're not an island to yourself. Now, if you want to do it all and you have the financial means to do so, God bless you. But if you want to save your tribe some money, try to go after whatever the state is offering or the federal government is offering, because they're there for the purpose of helping. And when they fill out their various reports, guess what? There's a question on there that says, have you reached out to your federally recognized tribes in your state? The federal agency, Indian Health Services, Bureau of Indian Affairs, the Centers for Disease Control and Prevention, USET, Public Health, HRSA, it's imperative that you stay informed and connected to these federal agencies because during the pandemic, you were able to find out what was available, what were their successes, and what others have accomplished. And again, you should not have to reinvent the wheel. Tribal Council established a public health authority and quarantine and isolation code, which is enforceable by law enforcement and tribal courts. If found guilty, it is a misdemeanor, and your fines can run from anywhere from $500 to $1,000. Now, we'll tell you with the Public Health Authority, it's a board of 3 people. And yes, you guessed right. Yours truly here, Human Services Director, is the chairperson, and we have the fire chief and the police chief. But thank God we've never had to even convene a meeting, which I should have had a meeting because we could have had probably some snacks. But we didn't have to convene a meeting, but it was the purpose of establishing this board was to address any issues pertaining to non-compliance of the code. Tribal government also established a provision of contracting with another physician not employed with the tribe to handle decisions regarding employees needing to be tested and returning to work following a diagnosis of COVID-19. And I did mention to you in the beginning of this presentation that I would explain more. This helped our physician, who is primarily the physician of most of the tribal members, not to be in a position of determining when that person would return back to work. As all of us know, there were people who thought in the beginning that COVID was a hoax. It wasn't true. I tell them, go to the graveyard and speak to all those people who lost their lives. But having a contract physician, HR was able to make those referrals. That contract physician was able to determine what type of test, if they needed to have the analyzer done within 5 minutes, or if they could do a test through a commercial lab. And it helped our clinic tremendously. And we were able to pay for that person out of our HRSA funds. Our lab technician helped. She was paid out of HRSA funds because she was able to help with the testing and the analyzing of the test. And then through our provider relief fund, we were able to keep her on in her providing other services and helping our nursing staff. Additional staff through contracting and are provided by HRSA, CDC, and USET helped tremendously as it provided more support for our frontline workers in having knowledgeable surge staff to consult with and in some cases share duties. And this also reduced staff fatigue and burnout. And we had through USET and the CDC, we had an epidemiologist, Dr. Norita Goff. And for our physician, who is a solo physician in a clinic, this helped him tremendously to be able to talk about these cases and talk about what needed to be done. The tribe successfully applying for grants which met the basic needs of tribal members, such as food, financial assistance to help pay utilities, house payments, etc., for those unemployed, underemployed, recovering from COVID-19, quarantined, and isolated. This helped our tribal members to be able to stay home to stop the spread. And Ida's going to talk more about what the social services staff had to do. But people know you really care when you care about those things that matter most to them. And making sure they're not going to get evicted, making sure they had food, even when they were unemployed and had no means of income, made a big difference in our success of people being able to stay home, let us do what we needed to do to help them stay home, and that thus stop the spread of the virus. Ida?
Reassignment and sharing of duties by staff to provide coverage and lessening the workload. Social services staff were tasked with entering data to reporting agencies of numbers of patients testing positive for COVID-19. Social service staff reported through IHS, REDCap, which is the state's website. Initially, the social services department was conducting contract tracing, making grocery runs, picking up mail, delivering medication, homework to any household that was quarantined or isolated.
In other words, whatever ails the tribal member.
Whatever ails the tribal member. Random COVID-19 testing of the health clinic and social services employees helped to slow down the virus among staff members and their families, as well as the patients and clients doing business with the departments. I'm fortunate enough to say that Ms. Karen and I may be the only two that have not contracted COVID during this time. The health clinic also developed a COVID-19 testing policy to prioritize level of testing, contact tracing, and notification. The Tribal Council developed a COVID-19 preparedness plan for the Chitimacha Tribe of Louisiana and their employees.
Well, you've been a great audience, and I hope that something that we said that maybe you can utilize. We encourage you to think out of the box in terms of services that you can provide for your tribal citizens and your employees. And even though COVID is not over, the pandemic is still alive at this point in time, we all have to just continue to be safe. So at this time, if you have any questions, we'll be more than happy to try to answer them. And I think we have about 4 minutes, probably before your next session.
Thank you, Karen and Ida. Do we have any questions in the room or any questions in the virtual attendees? Yes, we do have a question over here.
Not necessarily a question. I was just going to introduce myself, Miss Ida, Miss Karen. My name is Shadane. I'm a member of the Oglala Lakota Nation. I'm actually a tribal specialist with the U.S. Census Bureau, and I am your support specialist for the Chitimacha tribe. So I look forward to reaching out to you. I have sent a couple emails over to Megan Pursilver. I'll forward that over to you guys to loop you into that. But basically, I provide data to help you with any kind of community planning. As you are pursuing any funding or resources for the tribal nation, happy to be a support for you to access that data. So look forward to connecting
Wonderful. Again. Well, nice meeting you, and we look
much.
forward to hearing from you.
Yeah, I'm planning an on-site visit this October, so I hope to get to meet you in person in October. So thank you.
Great. Please make a point to meet us. Once you meet us, you're going to love us. And we're going to get you some gumbo.
Do we have any other questions, comments? Yes.
Hey y'all. So when you talk about communication between the different departments and programs, did you guys have any very specific best practices? Like, did you guys have a monthly meeting, or did you just have an ongoing email chain or chat group? I was just kind of curious what that might look like.
Well, basically what it is, because we are relatively small, we could have communication almost daily with whatever we're needing, whatever projects we're doing, we contact the other departments and get them on board. And so I'm gonna give you a good example, like after COVID first started, there were some bags that we were able to put together with some infrared thermometers and some, I think we even might have put, okay, did we do a meal with that bag? It was like just a whole lot of items we put together along with a meal. And we called our fire department, police department. They came over, they helped our staff to go on the reservation from house to house and deliver.
You also did team leaders once directors.
And we do have team leaders meeting of all of the directors, which just restarted again after, I think, a year we have not had it. But we meet once a month with our administration, with our tribal chairman, as well as our CAO, and any tribal council member is welcome to come in and join. And what we do at the team leaders meeting, which is a good opportunity for everyone to know what everyone is doing, is that we present what our departments are doing, what activities are coming up. And a lot of times we're able to also have people sign on there. It's just like, we have a diabetes grant. And I mean, our fitness center, our elders program at River Cane, all of them are part of that. And so what we do, we just took out to 100 households of elders over 55 years of age. Our health clinic, community health representatives just distributed a bag. We were able to purchase, I call it low, the word escapes me, I'm surprised. Low impact things that they can utilize to be able to exercise, like the one you put on the floor and you move your legs and that kind of thing. So we try to do that to help them to remain active as much as they can as we attempt to try to reduce diabetes or prevent diabetes and help those with it manage it. So, like I said, I can pick up the phone and call any one of them and say, look, this is what's going on. We need y'all. They're there and they're happy to do so. And likewise, if they have, things going on, like right now, we're looking at a lunch and learn. And so our fitness center is spearheading that. They've talked to us, and what we want to do is do a light luncheon, whereas the tribe here actually provide us with 3 days a week for 30 minutes that we can go exercise while on the job. And I share with people, I've been here 21 years, and you'll never be able to say that Karen Matthews abused her fitness leave, because I haven't. But I do applaud those. We do have fitness challenges that we do, and we participate for so many weeks. And we're getting ready to go into our 4th challenge. I think we had double down, triple threat. We name them all these things, and now we're the
quadruple bypass.
Okay, so we try to encourage people to exercise and to help. Because in Louisiana, we do have good food and it's hard to walk away from, but we are trying. So I hope that helps you in terms of your question. I may have got a little sidetracked with that food.
We have one more question here, Karen.
Great job, ladies. I learned a whole lot, even though I thought I might not. We learned a whole lot. So as far as your preparedness plan, is it something that, let's say, God forbid, there's another pandemic of some sort that we have to prepare for another, disease? Is your preparedness plan something that could be modified to easily adjust, or is it specific to COVID-19?
No, it can be easily adjusted. And basically, it really speaks more to not necessarily just COVID, but any type of disease that would impact the tribe. So the way it's written, it's like 17 pages of our ordinance that we have. Well, I'll say the code, the law, it's about 17 pages, and the way it's written not necessarily just for COVID, but anything that would pretty much threaten, the health and wellness and welfare of tribal citizens.
Thank you, Miss Karen and Miss Ida.
You're
On
welcome.
behalf of USET, we will be sending you a Sage gift set. We were so excited to see you all in person, but thankfully we have virtual options to where we could still get you zoomed in here for your presentation. It was great.
Thank you.
Thank you so much.
And if it's okay with you, if anyone asks, we can share your contact information.
Oh,
And you can get in
definitely.
contact with them, so.
Yeah, definitely. And actually I think the last slide has our contact information. Let's see if we go to, well, we wanted to give special thanks to USET for inviting us, to Brian Hendricks and to Amanda Watts and to Angela and to Brennan, our IT who's here, who made sure we didn't mess this up. And also to Latasha Allen. She is our newest worker. She's actually in tribal court right now. Probably wishing we get there. And she helped with our PowerPoint. So, and that's our information. And look, Chittimacha is a tribe that is always helping others. They don't really want to see other people have to, recreate the wheel. And so we share. So if someone want to reach out to us, please feel free and call. Like Ida said, we don't turn anybody away. We're going to find a resource for you. And so, so please feel free to call us. And we're glad that, the information is helpful to you all. And like I said, we just kind of all work together as a team. And I think that truly is, that helped our success in terms of having 0 deaths, as well as only 2 people hospitalized, and our COVID numbers were relatively low. But like everyone else across the country, I think around that Thanksgiving, Christmas, New Year time, I think that was the highest it ever had spiked up. I think it went up to like maybe 50 some people. And I mean, usually we would have 1 or 2 positive cases every now and then. And that included. And okay, so we have some stats for you all before we close out. In January of 2022, we had 75 cases, and that's like really outrageous for us. That's the highest. In February of 2022, we had 16 cases. In March 2022, we had 2 cases. April 22, we had 0 cases. In May 22, we had 2 cases. And then from June 1st to June 9th, because we were having an election and they call it the
meeting that we had.
The general meeting. We had only 4 cases. So and that was positive cases. So it shows you that, our positive rate is relatively low.
That's great to hear. So thank you for your presentation, and hopefully we'll get to see you in person sometime soon. And thank you all for attending today.
You're quite welcome, and thank you all.